Well, good evening, and thank you for having me speak tonight. So, part of what I do in my job is that I help to develop software and technology that allows for collaboration and data sharing across multiple sectors, jurisdictions, and platforms. And part of my talk with you this evening is about the data that's being captured around the substance use disorder within our community, specifically within Lehigh County. And I'm hoping that the data I share with you tonight is going to help change, maybe even shift perspective on what we believe the issues are around this very important topic. But before I delve into the data, I want to tell you a story about how this data came to be. Okay. So as police departments across the state were participating in the naloxone program, and naloxone is the drug that's used to reverse an overdose from opioid, we started to notice what's called compassion fatigue in our first responders. Some of the discussions we had with them, we were hearing reoccurring themes. They felt that they couldn't keep up, that they weren't helping the situation, that they weren't curbing the opioid epidemic, and that they couldn't get the people the help and the treatment that they needed. They felt they were seeing the same faces over and over and over, that it was a revolving door, and law enforcement felt like nothing more than a Band-Aid. So compassion fatigue can lead to burnout, and that's something that we wanted to avoid. So we had to find a way to reduce the fatigue, yet keep pace with the demand of services needed. And then from the healthcare sector, hospitals were also encountering naloxone patients in record numbers. But our warm handoff process, that's where the hospital refers the patient to resources for recovery that needed a little bit of tweaking. Because the federal money provided for this service stated that referrals could only come from the emergency department in the hospital, and they could only be opioid related, which is unfortunate because returning home from the hospital without addressing addiction, no matter the substance of abuse, can have serious, if not deadly, consequences. So we began to ask ourselves the following questions. How can we better support the addicted individuals and their families in this? How can we better support law enforcement through this? How can we include hospitals and our healthcare partners? And then how do we involve our county coroner's office so that we could gain an even broader insight into the toxicology associated with the drug-related deaths in the community? So the resulting solutions to those questions was the development of two systems, the Blue Guardian program and the hospital opioid support team. So the Blue Guardian program is a collaborative effort between the Lehigh County Department of Drug and Alcohol, the Lehigh County District Attorney's Office, and the Lehigh County Regional Intelligence and Investigation Center. And what it does, it's a program that uses the existing relationships between police and their communities to assist individuals and families that are plagued by opioid addiction and accessing treatment. And we started the program, we went live with it in March of 2018. It encompasses a uniformed police officer and a certified recovery specialist together to visit the home of an individual who had a naloxone reversal performed by the police. And then we engaged them into treatment. And we found that by doing this, by going to their home instead of waiting for them to come to us for help, it helps lessen the barriers and obstacles that exist when accessing treatment. So the 6 basic steps to the program are that police administer naloxone. Information on the event is then entered into the Blue Guardian application. The information is used to notify our county Department of Drug and Alcohol, who then contacts a certified recovery specialist to schedule a Blue Guardian visit, and then they go and engage the individual and family into treatment supports and options. And then all of the information of this entire sequence of events is entered into what's called the Blue Guardian application. And these become the first data points that we can analyze. So what can it tell us? So it can show us a migration path that shows us movement, that shows us where people are coming from, where they live, their residence, and then where they are going to do their drugs and unfortunately overdose. And what we've learned that is we have many people that live outside of Lehigh County that overdose in our county, but it's problematic with trying to engage them into treatment through the Blue Guardian program because technically we can't use Lehigh County resources and funding to do that. Another data point that we're capturing is on identifiable markings or drug brands of heroin that are found at a drug investigation, an overdose, or a drug-related death. So this data allows us to alert our partners of what we're seeing in the field. We're associating fatal and non-fatal overdoses with the markings that are being identified. Then we decided to partner up with our county coroner's office. So one of the things that we wanted to understand about drug-related deaths are demographics: gender, age range, employment, education. And what we discovered is that white males between 30 and 35 years of age with a high school education who are employed in the trade industry are the hardest hit demographic. But then in addition to that, we wanted to examine the toxicology associated with the drug-related deaths, because we wanted to figure out how many drug-related deaths where fentanyl played a role. So from 2015 to 2018, there were over 600 drug-related deaths in Lehigh County alone, 30% of which were associated with fentanyl. The next data points I want to share with you are being captured by our healthcare partners at Lehigh Valley Health Network and St. Luke's University Health Network through the Hospital Opioid Support Team. So the HOST program has personnel within the emergency department to address the needs of those suffering from addictions and overdose. It's much like the Blue Guardian program. They work to offer treatment options and support. So it's this patient linkage to treatment, that's what constitutes the warm handoff. Prior to the HOST program in 2017, hospital referrals to County Drug and Alcohol Department were low. There were only about 40 per year. But since the HOST program, we have received over 2,700 referrals. So the high referral rate reflects on the expansion of the warm handoff directive that we did in Lehigh County. We now accept referrals from all hospital departments, not just the emergency department, and we accept all substances of use, not just opioids. We're also tracking referrals by hospital and campus to get a better understanding of the needs within the communities surrounding those locations, as well as their recommended level of care, from short-term outpatient to hospital-based detox. So when we look at the HOST data, it helps broaden our perspective a little more. Some of the data they're capturing are the primary, secondary, and tertiary drugs of choice. So the top 5 drugs of choice, according to the data since January 2018, alcohol remains at the top, followed by heroin, then cocaine, then methamphetamines, and then marijuana. And then if we look at combinations of primary and secondary drugs combined, we see that alcohol is still the primary with no secondary associated. That's that large red sphere in the lower left-hand corner of the graph, followed by heroin with no secondary associated. Then heroin is the primary with methamphetamine as the secondary, and then heroin is the primary and cocaine is the secondary. And then if we overlay insurance data, we see that opioids show the highest claim in Lehigh County, over 218,000 claims for a 1-year time frame. And those are claims that doesn't represent patients. A patient can have multiple claims for treatment. But then the next highest claim is for alcohol, but that's only at 15,000 claims for the same time frame. And yet the data I just showed you pointed out that alcohol is the primary substance of abuse. So why are the claims for alcohol so low? So part of that is tied to funding. The opioid funding we received at a county level for 2018-2019 was around $1.9 million. And in that same time frame, we only received around $442,000 for alcohol. So there's a disparity within the funding streams to help offset the cost. Yet, the cost to treat opioids and alcohol are the same for short-term, long-term, or a hybrid approach of short-term with some type of sober living arrangement. And then lastly, I wanted to share with you the sales figures for state liquor stores just in Lehigh County. So for fiscal year 2017-2018, they did over $75 million in sales, and this does not include beer distributors. So somewhere within there, we need to rethink this math, and we have to help address alcohol issues in our community as well. So now let's look at the outcomes of the programs that I just told you about. So the Blue Guardian system captured 273 naloxone administrations from police in Lehigh County from March of 2018 through the end of September of this year. Of that number, 92 of the individuals who received naloxone live outside of Lehigh County, which means that we cannot engage them in treatment. Another 88 either refused services, were difficult to locate, or the visit was with the household member that we encountered, not the individual addicted, or the naloxone reversal was not successful. But out of the 93 face-to-face Blue Guardian visits with the addicted individual, 53% of them entered treatment. And that's a really, really good number. And that speaks to the model of us going to them in the community, not waiting for them to come to us. And then the host program, thanks to the expanded warm handoff process in Lehigh County, it has allowed us to place more people in treatment based on their need, regardless of substance abuse. So what are the takeaways from this? So what's the data trying to tell us? So the data being captured in these systems is reminding us that the substance use disorder in our community is much larger than just opioids alone. In fact, the highest data point that I showed you was about alcohol, which suggests that we need to make improvements on accessing treatment supports for alcohol. The data also showed us that 67% of the individuals who received naloxone in the Blue Guardian program reside outside of Lehigh County. So that suggests that we need to expand our geography and look at regional approaches to these types of programs so that we can help even more people get into treatment. Thank you.